This ailing 7-year-old boy, whom we shall call Joshua, bears a lot of pain as a result of his affliction. His mother says he can hardly eat. She says it's like his teeth are falling out. Dr. Samuel Guma, a specialist at Kawempe Home Care, says Joshua suffers from a cancer which is common amongst children known as Burkitt's lymphoma. The doctor also reveals that the cancer is in its advanced stages.
It's complicated by the HIV.
This is a grim episode of Joshua, who was born with HIV alongside his twin brother, who is not ailing as he is.
He's getting his ARVs well, taking them well, alongside the morphine for the pain.
So he's also taking his cancer meds?
Yes. The cancer meds are given intravenously through the vein, and they are given appointments in Mulago.
Joshua had been rushed to Kawempe Home Care after his neighbor got concerned about Joshua's plight.
We need to care for his the tumor, the pain, and all the physical problems that he has, the discharge, the bleeding and everything. And also we need to really think about the family. I mean, the psychological problems that they're going through, the stigma in the community to his disfigurement.
Such treatment is what is termed as palliative care. Joshua's ailment underpins a growing trend of cancer amongst HIV-positive patients.
HIV positivity makes it even worse and difficult to treat.
27-year-old Peter is battling Kaposi sarcoma, a cancer which is common amongst HIV/AIDS patients. It was earlier on this year that Peter learned of his plight.
From home, I came to this home care. I was on the verge of death.
Basically swelling of his abdomen and also fluid in his chest as a result of the cancer. And what we've done is we've been draining the fluid from parts of his body, put him on medication that can remove the fluid, and also medication to control his pain.
His mother, who is also HIV positive, has also been getting treatment and counseling from Kawempe Home Care, which is funded by the Infectious Diseases Institute, Centers for Disease Control and Prevention, Hope for Children International, and the Ministry of Health. Though the country doesn't have a policy on palliative care, the Ministry of Health recognizes it as an integral part of treatment.
It is included as part of the minimum health care package. Access to treatment for malaria is essential. So even access for palliative care interventions is essential. According
to Dr. Dungu, a specialist in blood medicine at Mulago Hospital, diseases that are life-threatening like cancer, HIV and AIDS, end-stage kidney disease and heart disease can be treated with palliative care. But the lethal strain of cancer and HIV poses a monumental challenge.
When someone comes in and they say, we can no longer give you chemotherapy, or we can no longer give you radiation therapy, it means you've achieved what your body can take. And then we look at other interventions, particularly palliative care.
Kawempe Home Care is amongst the few centers that offers palliative care in the country.
We've been able to provide the service and train people throughout the country, and we've been to over 60 districts already, where we train health workers and non-health workers so that they are able to offer this service.
Uganda is the only country that allows untrained medical workers to prescribe medicines that are used in palliative care. Jalia Namboze is amongst the volunteers who treats patients.
They are welcoming as a relative. They just tell their children, this is aunt, this is granny.
She often meets challenges, especially in homes where patients don't have caretakers.
You turn the mattress to take the mattress outside for the sunshine. You find all the tablets down the mattress. So these people, they need care and counseling ongoing.
Palliative care is not only restricted to getting medicines from the hospitals or home care facilities. It involves even stretching as far as going to these patients' homes and showing them that there is someone out there who cares. In a week, they could visit us 4 times and help us with turning him, she says.
His immunity is getting better, and the good thing with this cancer, with a good chemotherapy, it can get better, and lesions resolve with also the ART going hand in hand.
For little Joshua, the danger is imminent. He may not celebrate his next birthday.
When the end comes, really, we need to be there to support the family and take them through the process, and also the bereavement aspect.
Joshua's treatment schedule is intense.
Pain is so strong, so severe in patients with cancer and HIV and sickle cell and others. We use medicines that are categorized as narcotics or opioids. Uganda has endorsed access to those medicines. We call them morphine.
The frequency is around 5 times of oral morphine. They take it 4 times during the day and once at night.
Palliative care, like in Peter's case, is not restricted to patients who are terminally ill. Quick facts about palliative care, according to WHO: it provides relief from pain and other distressing symptoms. It affirms life and regards dying as a normal process, and it intends neither to hasten or postpone death. Also, it may positively influence the course of illness.
Because you've controlled all the suffering, they're able to take their medicines, they're able to live without, spending sleepless nights.
Dr. Dungu often plays music for his patients.
We encourage special lights sometimes, people watching movies if they want. Those are other non-medicinal interventions.
Palliative care has been integrated in the treatment manual of the Uganda Cancer Institute, Makerere and Mulago hospitals. When a patient is terminally ill, palliative care ensures that he or she bears less pain and a dignified death. Florence Salimba, NTV.